Hey everyone, today we're going to be talking about travel nursing and travel CNA. A lot of people don't think of travel CNA, they just think of, nurses doing travel nursing. CNA is definitely a big thing, and I can tell you from my experience, it's been pretty rewarding. What we're going to go over in this video are the pros and cons of having a full-time job, and then the pros and cons of doing travel CNA and what that is like. I want to go over 4 pros. The first pro is that there's stability in routine. There's an element of predictability. Every week you're gonna know what your schedule is. Every day you're gonna have a general idea of what you're showing up for. And you're gonna have an idea of what your routines are for your job that you're doing. The second pro is that you can have skill development. And what I mean by this is that when you have a normal full-time job, you build camaraderie with people, and it allows you to build skills because, say, if you're a CNA, a lot of the times it's a big learning curve, and for nurses it is as well. But for CNAs, sometimes nurses will teach you things and that you didn't learn in school, or you'll see things from patients that you didn't learn in school yet. Along with this, you gain experience in the field that you go into. For example, if you go into renal telemetry or cardiac telemetry, every day you harp on those skills and you learn more and more, and you learn more about the procedures, you learn more about maybe the medications, the symptoms, the side effects. You learn how the patients are going to present. You know if you walk in and a patient is diaphoretic or if they have a fever. You catch things a little faster because you're so used to seeing the similar things every day. The third pro on the list is team integration. What I mean by this is that you really build a camaraderie when you work somewhere full-time. You get to know your coworkers, you get to know the management, you get to know some of the patients that have been there for a long time. It really builds a strong friendship. In some instances, you'll view these people kind of like family. And I could say for my last job, every day felt great going into work because of the people that you work with. And even when times get stressed or tough, things get busy, you look around and you see them feeling stressed just with you. And there are moments where they're gonna have your back and you're gonna have their back. So I wanna highlight the importance of this, that you're gonna build strong, long-lasting friendships with your colleagues. The fourth pro on the list is that you're gonna get familiar with the protocols. You're gonna get familiar with all of the codes for the doors. You're gonna get familiar with all of the codes on the overhead. If there's a code gold, code pink, code red, you're gonna know that that's a fire code. If there's a code gray, these are important things that each hospital might have a little different. But even just familiarizing yourself with where the lab is and where the cafeteria is and where the bathrooms are, these little things, they save a lot of time. And there's a comfortability aspect to knowing where everything's at. So now I wanna go into the cons of working a normal full-time job. And the first one is that there's limited variety. And what I mean by that is that although it's nice, you could get used to all of the protocols and you build camaraderie and you know the codes. At the same time, it kind of limits your exposure a little bit if you like variety and you like seeing different things. And that goes into con number 2, is that there's less flexibility. Oftentimes, you may not control your schedule. Your manager may control your schedule. If you want a certain day off, you'll have to get it approved. For holidays, you're going to be forced to work maybe a specific number of holidays for the year, and it gets raffled off. Maybe some people have been there longer, or whoever wants a holiday a little more, or they have an excuse as to why they need this holiday off. So these are just a couple of things to keep in mind. If you are thinking of becoming a CNA and maybe you're in CNA school right now, or you are already a CNA and you have to retake your state certification test coming up, there's a link below to CNA Mastery Center. We have 20 lessons that are at an accelerated pace. There's over 1,000 mock test questions and over 600 flashcards with definition explanations for all of the answers. So if you're about to take the CNA state nursing test anytime soon, I highly recommend the program that CNA Mastery Center has. It's a one-click, easy, lesson by lesson. It goes everything from proper body mechanics to ethics and policy to handling emergency situations and having good communication skills with patients. So if you're interested, click the link below. And the third con on the list is that you can experience burnout. And this happens in any area of the hospital, but if you're showing up to the same job every day and caught up in the overtime, may feel a little bit miserable coming into work, this is where burnout can definitely set in. So the fourth con on the full-time job list is that there's lower pay. Let's face it, after a long day's work, you love what you do, but pay does make a difference. And you want to feel like you're being taken care of and you're appreciated for the hard work that you do. So now let's get into travel CNA. What's it like being a travel CNA? What are the pros? What are the cons? The first pro, you're going to get a diverse experience. You may not know where you're going. You may not register for your shift till the day before. You could do full-time, part-time, or per diem. What I've done is per diem because since I'm in school right now, it works with my schedule. So about the night before, the week before, you look on your app and you'll see what hospitals are available or what shifts are available, but you don't actually know what floor you're going to. And oftentimes, say if you're registered for a networking system, Kaiser or Providence, there's a lot of hospitals that are within that network, and you might not even know what hospital you're going to until the shift pops up and you say, okay, this hospital in this city is available. I'm going to register for this shift. But again, you still don't actually know what floor you're going to, and you still have the variety of going to a completely new hospital. And at the end of the day, if this hospital is something that you didn't like, it's only a 13-week contract or sometimes less. And then you could register for an entirely new contract with a new hospital or networking system. The second pro on the travel nursing list is that the pay is higher. At my previous job, the CNAs would typically start out around $20 to $24. That's kind of the average, at least for the hospitals in Southern California. If you work a per diem, you may get a little more. I've heard upwards of $26, but that's kind of rare. The majority of the time, it's going to be around that $21 range for a full-time job. But as a travel CNA, the pay is going to be anywhere from $25 to $30 for the first 8 hours, and then the last 4, you're going to get time and a half. At my job now, I'm getting $30 an hour, and the last 4 hours I get time and a half, so it's $45 an hour. And at the end of the shift, it equals out, I think, around $392 or $400, something like that. Whereas my previous job, I was getting maybe $200. Earning potential with travel CNA is so much better than working a full-time job. The third pro on the travel nursing list is that there's flexibility. If I don't want to work a certain day, I don't have to work that day. I could register for as many shifts as I want, or I could register for as little of shifts as I want. And that's with the per diem aspect. If you work full-time, you're going to be responsible for a full-time amount of shifts, but even then you're still only doing a small contract, and then you can move on to the next hospital. Along with the flexibility aspect, if you want to travel, actually travel, I've seen jobs in Hawaii, I've seen jobs in the snow in Minnesota and Oregon, Washington. My job currently right now is in California. At my last shift, somebody called me a fake travel because I live 35 minutes away. But the reality is, if you want to work close, you could work close. And if you want to travel, you could travel. The fourth pro on the travel CNA list, you have rapid skill acquisition. When you show up to your job as a CNA, you're going to learn a lot of new things. You're constantly going to different floors. You're going to learn so much. So if you like change and you like experiencing new things, you're going to love it. So now the cons of travel nursing, travel CNA. The first con is going to be unpredictability. There's going to be a constant change in your work environment, and some people may not like that. It can be a little unsettling showing up to a new workplace, not knowing anybody, not knowing where the bathrooms are or the cafeteria is, and you're walking around and you're looking for, just a coffee in the morning and you need to ask somebody for directions. These little things can make your day feel like it's dragging a lot longer, but over time, I'd say you do get used to the hospital. And the second con on the travel nursing list is that you have limited relationships. And when people know that you're a travel nurse or a travel CNA, they might be a little hesitant to treat you the same as everybody else. For the most part, everybody was super friendly. The nurses are friendly. The CNAs are willing to help you. Management is super friendly to you. They enjoy you being there and you're helping them out. The third con on the traveling list is that you may be frequently relocating. Especially if you want the higher paying jobs, this may require you to move to another state or another city. And if you're somebody that likes that stability of staying at home, maybe with your family, or if you have an apartment already, it's really hard to just get up and go, especially when you're paying rent. It can create an unstable environment, especially financially. So if you're somebody who really does not like to move around or travel, then travel nursing may not be for you. So the fourth con on the list, there's less job security. If you don't have another contract lined up right after the one that you're currently signed up for, there's a little bit of uncertainty that comes with that. Am I going to have an income for the next month? Do I have to settle on one that pays me less? So there could be a little bit of anxiety associated with travel nursing just because it's so unstable. From my experience, there's countless travel nursing jobs and travel CNA jobs, so That's never been an issue for me. My issue currently is that I'll have one contract and then I'll see another hospital that I really want to go work at, but I can't do all of these travel jobs all at once because it's just too much to handle. So in my experience, there's not a shortage of contracts. So those are the pros and cons. Whatever you decide to do is still an excellent career and an awesome choice. And whatever option you choose, just know that it does have merit and it's going to be specific to your individual priorities and circumstances. So that's it for today. Thank you so much for tuning in. If you have any questions, comment below. I'll get back to all the comments as soon as I can. Subscribe and like the video. It really helps out the channel and it helps me to keep producing more videos. Thank you so much, and I'll see you next time.